This week, we will be focusing on a holistic view of global health. The objective is how to relate issues involving global research and evidence-based nursing practice. The key terms and concepts for this week are global health research, complementary and alternative medicine, health indicators, scientific practice, and research in nursing. Global health research. Global health research is an international enterprise. It transcends national and political boundaries and politics and embraces shared responsibilities and cooperation. The complexities countries such as Communist China may control or even falsify data. Developing countries are striving for improvement and want research funding to improve conditions. Developed countries want to maintain or even improve status. Free and complete access to data may be seen as a threat to that status. Global health research. The global community generally and global research community are the global community where everyone is on the planet, while the global research community is a smaller group of scientists and field workers researching the health concerns in every area of the world. As an example, Communist China is a closed communist autocratic system. The us against them is one nation against another. Paradigm needs to shift for successful global research. Sharing health-related research, information, and statistics in an atmosphere of respect and trust would benefit the entire world. The 1090 debate. The Global Forum for Health Research raised concern about the 1090 gap, similar to ideas you have probably heard before about how life works, such as that 80% of the work is done by 20% of the people. The 1090 gap refers to the spending of 10% of resources being spent on diseases that affect 90% of the global burden of disease. Accessing data secondary. Taxonomy is the science of classification of data sources and consists of abstracts and summaries on global health issues, nationally sponsored reports by government agencies, independently published studies by global health researchers, tabulated data reported by national agencies, and secondary data available for integration and analysis by independent investigators. Accessing data secondary. For those who will be moving on to master's or doctoral thesis or dissertations, know that these are often done as secondary analysis of data from a previous study. There are a number of these resources listed on page 148 in Holtz. Collecting data. Primary may be hindered because of concerns of stigma. Government officials may try to suppress information about certain issues such as HIV and AIDS. And for researchers, flexibility is vital. We need to understand the primary question and adapt to local circumstances. Geographical information systems, from public health mapping and GIS to global health surveillance. Below is a website which completely explains the GIS public health mapping phenomenon. Evidence-based practice. It's the integration of best research evidence with clinical expertise and patient values to facilitate clinical decision-making. Research has repeatedly shown that nurses are highly motivated to be evidence-based practitioners. Evidence-based clinical decision-making should incorporate consideration of the patient's clinical state, the clinical setting, and clinical circumstances. In nursing, best research evidence refers to sound, clinical relevant research about the effectiveness and safety of nursing interventions, the accuracy and precision of nursing assessment measures, the power of prognostic markers, the strength of causal relationships, the cost effectiveness of nursing interventions, and the meaning of illness or patient experiences.